Hello and welcome to the World Economic Forum here in Geneva. My name is Adrian Monk and I'm joined in the studio by my colleague Peter Vanham.
Bonjour.
We have for this World Health Organization Africa briefing on COVID-19 in Brazzaville, Congo, Regional Director Dr Matshidiso Moeti. Welcome. We have in Dakar, Senegal, Marie-Pierre Poirier from UNICEF. In Nairobi, Kenya, Mohammed Abdiker from the International Organization for Migration. And also joining us on the line is the Forum's Head of Africa, Elsie Kanza. A big welcome to all of them, and we'll be turning to each of them for some opening remarks.
Et bienvenue aussi au Dr Michel Yao, qui est aussi au Congo-Brazzaville avec le Dr Moeti.
Thank you. Dr. Moeti in Brazzaville, could you give us the latest from your position on the crisis as it affects Africa right now?
Yes, thank you very much, and good afternoon to everyone who's joining us for this press conference. Thank you for having joined us. First of all, I'm very pleased to have colleagues from UNICEF, from IOM and WEF with me today, as the COVID-19 pandemic requires all of us to work together. It really requires a multi-sectoral, whole of society approach, and we can only succeed if we put all of our work together. We're seeing, for example, that the economic impact of this pandemic worldwide is extremely severe, and we expect, of course, since our countries have fragile economies, that it will be more so in African countries, especially for many of the vulnerable communities and households in Africa. And I'm sure we'll be hearing about that from my colleagues from UNICEF and the WEF, as also from IOM. The pandemic is continuing to rapidly evolve in Africa. And in the past week, there are now more than 10,000 people on the continent of Africa who have been confirmed as cases. And unfortunately, more than 500 people have lost their lives. There are also clusters of cases and community spread going on in at least 16 of our countries. So we are no longer speaking about imported cases, people that have traveled from somewhere else. We are seeing the epidemic also spread geographically within these countries beyond the capital cities, where it first manifests itself to the districts and local levels, which has serious implications for the responses expansion then. And this is in countries like Algeria, Senegal, Burkina Faso, Cameroon, and South Africa. 18 countries still have less than 20 confirmed cases reported. I have to say that some of these are the smaller countries that have had difficulties in putting in place testing capacity. But we still do have a significant number of countries where so far we are not detecting community spread, which emphasizes then the importance of continuing strongly with the public health measures that are meant to limit the spread of the virus. These, of course, are important even in countries where there is further geographic spread and community transmission. So I'd like to remind and emphasize again what these are. First of all, surveillance in order to identify cases, tracing the contacts of those cases, isolating both the contacts and the cases, providing care and treatment for the people who are ill, particularly those who are seriously ill with this virus, and very importantly, providing information to people in the community, hearing what are their beliefs and their understandings so that they are enabled to play their part on interventions such as physical and social distancing, hand washing, and cleaning surfaces in the house, at work, in order to minimize the spread of the virus. These are very important interventions. I'd also like to emphasize that as the epidemic spreads beyond capital cities, the response also needs to spread. So for example, capacity for testing needs to go beyond capital cities, and we need to really engage people at the community level, such as community health workers who have been put in place in some of the health services of our countries. Volunteers of partner organizations like the Red Cross need to be constantly in contact with people, and the governments need to mobilize the capacities to replicate these interventions all over countries at the local level. There's been a lot of discussion about the use of masks and the context of our African region, where we have, especially in low resource communities, real challenging in physical distancing in people's homes. WHO has updated the guidance around masks, still emphasizes very much the use of masks, particularly in healthcare settings, and masks of certain specifications, which we are confident can be effective. However, we are recognizing that in our difficult context in Africa, there may be the room for the use of other adopted masks, for example, masks made out of cotton to certain specifications, which are being circulated by some partner organizations. What is very important about this improvisation of the use of masks is that we should assure ourselves that they do not constitute a further risk of transmission. So people need to be guided very clearly how to use them safely. We recognize that this is a possibility that may be necessary in the difficult context in our region. We also, I'd like to emphasize the need to continue the provision of services for other priority health problems. So we have many people with HIV in the region, with tuberculosis. We need to prevent the spread of malaria and make sure people get treated promptly, because it's a major killer of children in our region. Children need to continue to be immunized. Women need to continue to have safe deliveries when they're having babies. So these also need to be put in place all around the countries, even as they're responding to the COVID-19 pandemic. So we are seeing, and I'm very happy to say, we're seeing at the political level on the continent, facilitated by the African Union, coming together of the leaders to recognize that they need to put in place, despite the lockdown measures, humanitarian corridors that will enable the movement of some of the expertise, the people, and very much the supplies that are required for the response to the COVID-19, and also for the provision of basic health services and dealing with other basic needs of people that go beyond health.
Dr.
Then
Moeti,
finally,
thank you. Sorry.
I'd just like to mention that last week, some scientists made some unfortunate remarks about vaccine trials in Africa. So I'd like to emphasize a couple of points about this, that we encourage countries to engage in vaccine trials that respect international standards in terms of ethics, in terms of respect for the rights of people. We encourage actually African countries to get involved in trials, not only for vaccines, but also for discovering therapeutics, because this is the way that they will be most adapted and relevant for African populations. But I'd like to emphasize that all the clinical trials will be undertaken absolutely respecting international standards. So I'd like to close and say that the health, social, and economic consequences of the pandemic will be profound worldwide and will be very severe in our regions, and urge and encourage that we all work together to help our countries minimize these impacts. Thank you very much.
Thanks, Dr. Moeti. And just a reminder, we have a lot of questions coming in from our participants and from people on the line. So with that in mind, just turning to a brief introduction to Dakar, Senegal, and Marie-Pierre Poirier from UNICEF.
Well, first, let me thank very much WHO and WEF for inviting UNICEF to take part in this media briefing. So if we look at COVID-19 numbers, we may think that children have been relatively spared by the global pandemic, definitely compared to adults, particularly the elderly. And while this may be true from a health perspective, based on data from China, Europe, the USA, we see a different picture if we look beyond health. In just a few months, COVID-19 has affected the lives of hundreds of millions of children around the globe. Children are now out of school. Many live in families where parents have lost their job, and we see increase in domestic violence and abuse. And here in Africa, children were already growing up in a challenging environment before the pandemic, as our region is grappling with multiple shocks. I'm thinking of conflict, displacement, disease outbreaks, malnutrition. COVID-19 does not discriminate, but its impact does. The vulnerable are the hardest hit. And so today we are looking at 128 million children out of school in the 24 countries of our West and Central Africa region. The number was 41 million before the epidemic. So huge, huge explosion. Violence against children and women is on the rise. And we, UNICEF, with our partners, are also concerned that the pandemic is starting to affect the malnutrition levels because of the disruptions of food systems and emergency and routine healthcare services. And then finally, all of the COVID-related measures that states are taking, containment measures, border closures, this is all increasingly making it difficult for the humanitarian community to fulfill our mission and responsibility to provide vital supplies and services to children and their families. So what are we doing about it with our partners? We are working to keep children healthy. Matshidiso Moeti alluded to it a moment ago. Life-saving maternal, newborn, and child health services need to be sustained, including those that were intended to protect the children against pneumonia, malaria, diarrhea. Immunization services need to go on so that children are protected against childhood diseases. We need to look for alternative education pathways to keep children learning. We need to accelerate access to water, particularly disadvantaged communities. We need to find new ways to protect children from violence. And we are advocating support for families to mitigate the socioeconomic impact of the pandemic. These packages need to have a child length to make sure that they are not forgotten. And then in all of what we do, we need to focus because the task is enormous. So particular groups are more vulnerable amongst the vulnerable. And we are thinking of children affected by conflict, displacement, children separated from their families, children in institutions, and girls, systematically girls and adolescent girls. So one thing, just to close up on this intro, one thing that we'd like also to put on the table and that we've learned over the years, including in our engagement with WHO and others in the recent Ebola pandemic, is the importance of community engagement. In our continent, this is key. We may have the best plan ever if communities are not part of it from the onset, and if they are not main actors of the plan, it will not work. Thank you again.
Thanks, Marie-Pierre. And yeah, it's great that we have a lot of people on the line who are keen to come in with questions, who represent those communities and communicate with them. Mohammed Abdiker in Nairobi, Kenya, from the International Organization for Migration. Can you just share with us a brief perspective on, from your vantage point there in Kenya?
Pastor, thank you very much to WHO and the World Economic Forum for hosting such an important dialogue with our members of the media. The pandemic has a severe impact on migrants, on IDPs, and mobility across Africa. It is a health crisis, yes, but mobility has become the key victim for us to be able to move around the continent. We are seeing a large number of migrants stranded at airports, at land borders, and at sea borders. As we speak right now, we have a large number of migrants in Djibouti, where we're setting up quarantine centers with the government of Djibouti. We have the same happening in Ethiopian side, have the same in Somalia, and we have the same between the borders of Burundi and Tanzania, and we're working with our member states. We also see something that we are trying to talk to our member states about, the deportations of migrants, which is seen as increasing. And we're very happy to see that regional economic blocs, including IGAD and others, are coming up on this to make sure that member states are talking to each other. We're seeing deportations increasing amongst member states, which is not the right thing to do at the moment with the pandemic. We're also seeing a large problem on aid flow to IDP camps and to migrant camps that we're dealing right now because of the restrictions of the borders. We see lack of access and medical care for migrants, both irregular and regular, and we're trying to talk to the member states that even though they are not their own citizens, they need to be given access to medical care. We're also worried very much about the stigma and the xenophobia that we see against migrants themselves, but against foreigners. that is coming up in many of the countries that we are dealing with right now. It's very difficult for us in the humanitarian setting, for example, to talk about physical distancing for IDP camps, for migrant camps, something that we need to work on with the WHO and our partners as well. The issue about self-isolation, how do we work on that in a very crowded places like IDP camps and migrant camps? How do we deal with that in the slums that we're going to be working on as well? Lastly, on a few key issues, economic impact. We see the severe economic impact right now. If you talk about remittances, most of the migrants in Europe or the US or the Gulf countries have lost their jobs. Nobody is sending money home to their parents or to their children. So education is going to be impacted, those who are paying for education, food, and the normal day-to-day allowance that they need to work on is becoming an issue that we're seeing right now. A good example is Somalia, where we send money through different aspects. Some carry cash from the US or from the Europe to come to Dubai and send it to Somalia. How are they going to deal if they cannot get the cash right away? We see the issue of people smuggling, which is becoming an issue for us. A good example is in West Africa, in Niger, where we've seen people smugglers and traffickers dropping large number of migrants in the desert because of the closure of the borders. How do we deal with that as well? It's an issue that we're dealing with. We are looking at the whole issue of humanitarian response needed for migrants, but also the IDPs and refugees that we're dealing with at the continent level. We are also looking at the whole issue of cross-border coordination between countries across the continent. Just by deporting 200 or 300, 3,000 people across border, you are increasing the risk of the pandemic going all over the place. How do we make sure that our member states stop this? We see that is happening right now, and we're happy that that discussion is happening with the member states, with WHO and our partners on the ground. Obviously, the key area where we work very closely with WHO is the issue of point of entry. How do we make sure our immigration officials, our customs officials are able to have the right sanitation, surveillance system, hygiene facilities at all the point of entrance that we are dealing with? And that also connects the whole issue of prevention materials for IDPs, for refugees, and also for migrants, and how we can make sure we provide that information to them. In closing, I think this is something we all have to deal with. We have different mandates, but we all think that mobility and migration touches on all of us, and we need to work together as an international community. Thank you very much.
Mohammed, thank you. And lastly, I'm going to turn to my colleague, Elsie Kanza, for a perspective on what business can do to help in this crisis. And Elsie, we just need to unmute you.
Thank you, Adrian. Can you hear me now?
We can hear you. Thank you.
Thank you. Yes, it's very unfortunate for Africa that its major trading partners and development partners in Asia, Europe, and now the USA have advanced the negative effects economically on the continent. And most important, by negatively impacting government revenues and the ability to respond to the crisis. And so on one level, just with respect to addressing the crisis, we're seeing partnerships emerging between governments and the private sector, both within the continent at a regional level, coordinated by the African Union, Africa Center for Disease Control, then also globally in terms of collaboration between global corporations, also supporting governments and working with the WHO and the African Union, but also collaborating with companies in the continent to see how they can repurpose their operations to address and build up the capabilities of the government to respond to the crisis. What we're also saying in terms of collaboration is, again, between the private sector and governments to come up with funds that can support and mitigate the economic and social effects. On a continental level, we've seen that the African Development Bank has managed to raise a solidarity bond, about $3 billion. Afro-Exim Bank has also established a fund to assist with the negative trade effects, another $3 billion. On national levels, you have stimulus packages that countries are putting together, individuals, philanthropists are also establishing. It's still too early to tell. As we've seen with the rest of the world, it will get worse before it gets better. And so there's a really urgent need to move fast, to be as effective as possible in addressing the crisis first, because the health getting ahead of the virus will very much influence when countries can emerge from lockdowns, when people can resume their normal livelihoods, and when we can all sort of normalize and start restoring resilience all around the world.
Elsie, thank you very much for that. Turning to questions now, we have a lot of questions to get through from participants. A first question from Nick Turse of Yahoo News, who's asking, US President Donald Trump has threatened to freeze funding for the WHO. What would that mean to Africa in terms of the pandemic? But I also want to bring in two questioners that we have on the line right now, Kwame Baekye from Pulse Ghana and Ochieng Ogodo from SciDevNet in Kenya. So perhaps we can go to their two questions, and maybe Kwame first.
Hello, thank you for this. I wanted to ask, what is the recovery rate for coronavirus cases recorded in Africa? Does it need to improve? And if it does, what is the plan based off on learnings we have from other continents?
Thank you, Kwame. And Ochieng, if we can get your question as well.
Thank you. My question most likely goes to Dr. Moeti. Do you see this pandemic hurting Africa's efforts to realize the SDGs? And which SDGs do you think may be most adversely impacted, especially in the health sector? Are there any gains that may be rolled back?
Thanks for that. Thanks for those questions. I think all of our panelists can probably come in on that point. But first, perhaps turning back to Dr. Moeti in Brazzaville on some of that. You heard from Nick Turse at Yahoo asking about funding, and then on recovery rates, and from Ochieng about the SDGs.
Yes, thank you very much. First of all, with regard to the United States, the USA is among WHO's top 5 financial contributors, donors, I would say. So they play a very important role in the financing of the WHO at the global level, enabling us to do our work. So that if that decision was carried out, it would have a significant impact on our ability to carry out our programs in general. And when I say this, I'm not talking about contribution to the COVID response, but more broadly to program areas such as HIV, malaria, tuberculosis, and other aspects of our work, maternal and child health, and so forth. I think I can only emphasize what has been said on this subject already, that this response to this pandemic requires international and global solidarity. It requires us all to work together in order to mitigate the impact on people everywhere in the world. So we're very much hoping that we can continue to work together in that spirit and overcome this very big threat to not only people in Africa, but also people in the world, all over the world. As far as recovery rates are concerned, we've observed, or we have found that the recovery rates in Africa are about 9.4%. I think this is slightly lower than some of the recovery in some of the other regions in Asia and in European countries. Clearly, we have, up to now, I can say that the number of countries where there has been cases is relatively limited in Africa. I think we can collect more data as we see the outbreak unfold in more countries to be able to calculate this better. But we do know, of course, that there are people in our region with pre-existing conditions. The healthcare settings of our countries are very much challenged to be up to the mark. So this is a challenge that we'll continue to look at. And then the impact on the Sustainable Development Goals. Well, I think if we look at the economic impact that's happening in the world and in Africa, and that is projected, and again, remembering that our region started confirming and seeing cases later than has been the onset in other regions. So we're expecting the situation to still unfold and more people to be infected. And if we look, it already has been said by my colleagues, at the multifaceted impacts of the measures that have been put in place, the lockdowns. I've seen estimates that it'll take several years for the economic recovery to happen in regions that have stronger economies than in Africa. So I think inevitably there will be an impact on the progress that was being made to achieve the Sustainable Development Goals across the board. That is why all the interventions are so urgently needed and are so very important, not only in health, but the impact mitigation that my colleagues have already mentioned are absolutely important so that we minimize this long-term impact on development in Africa and in other regions. Thank you.
Thank you, Dr. Moeti. And maybe I can turn to Nairobi and to Mohammed there and just ask your take on the SDG point and if you're concerned regarding rollback.
Obviously, we are all very concerned. There's going to be a major impact on us achieving the SDGs if we're going to take up several years to recover from what we're having right now. Just as by mentioning the number of remittances coming up from our global migrants that's coming to Africa, sometimes even higher than the GDP of the countries we're having right now. Just showing that small impact that we're having in countries like Somalia and also countries in the Horn of Africa, but also the whole of Africa. So obviously there's going to be a major impact on this.
Thank you. And turning perhaps to Marie-Pierre in Sénégal, and peut-être vous pouvez répondre en français.
Bon, j'en ai dit quelques mots dans mon introduction. Nous faisons beaucoup de soucis parce que c'est vrai que cette attention nécessaire à la réponse à la pandémie du Covid-19 amène les énergies, les ressources humaines et financières à se polariser pour cette réponse qui doit être globale et solidaire. Mais nous voyons un impact immédiat. J'ai parlé dans le domaine de l'éducation. L'un des objectifs très spécifiques que nous souhaitions atteindre dans le domaine de l'éducation avec les objectifs de développement durable était de diminuer le nombre d'enfants hors de l'école. Or, je vous ai donné les chiffres, on avait un défi de 41 millions dans la région d'Afrique de l'Ouest et du Centre, on est passé à 128 millions. Et comme vous savez, ce phénomène affecte la plupart des pays de la planète. Nous sommes très préoccupés également des progrès qui étaient faits dans le domaine de l'immunisation, la vaccination de routine, et simplement avec des problèmes de logistique, de déplacement. Nous avons plus de difficultés en ce moment à acheminer les vaccins, à la fois dans les pays et puis de ces pays jusqu'aux postes de santé plus éloignés où ils doivent être utilisés. Donc, effectivement, la réponse pour le Covid est nécessaire, mais il faut consolider, maintenir et trouver des méthodes alternatives qui protègent les agents de santé communautaires, qui protègent tous ceux qui travaillent vaillamment dans les centres de santé pour maintenir les services de base aux communautés dans le domaine de la santé, trouver des solutions innovatrices pour maintenir l'éducation, accélérer les programmes d'eau et d'assainissement. Le temps n'est pas à l'hésitation, mais plutôt à l'innovation pour trouver des façons de continuer à aller de l'avant.
Merci. Et je peut-être en tournant vers Dr Yao, parce qu'il y a aussi des journalistes qui se posent la question, est-ce que l'OMS a été surpris par la pandémie Covid-19 et est-elle coupable du manque d'anticipation peut-être en Afrique? C'est une question de Fernand Dédé, journaliste indépendant qui est basé à Abidjan, à Côte d'Ivoire. Et peut-être si vous pouvez aussi nous dire, c'est Mohammed Abdiker de Sénégal qui se pose cette question, à quel moment est-ce qu'on peut s'attendre au pic de la pandémie en Afrique? C'est une question aussi que les gens se posent. Donc peut-être aussi résumer la situation actuelle en Afrique des cas autour le continent.
Merci beaucoup. En ce qui concerne cette pandémie, l'OMS se préparait à une pandémie notamment liée à la grippe. Et donc, c'est d'ailleurs ces structures-là qui ont permis d'aller vite parce que cette épidémie a commencé fin décembre, mais déjà au mois de janvier, la plupart de nos pays se préparaient. Et si on regarde par exemple les laboratoires, on a bâti sur le réseau de laboratoires en Afrique qui existaient déjà. Nous sommes passés très rapidement de 2 laboratoires opérationnels à près de 45 laboratoires qui sont pleinement opérationnels en Afrique subsaharienne. Donc, la préparation avait commencé, mais l'ampleur a été grande parce que ce sont des virus qui ne sont pas connus. Et même si ça avait été un virus de la grippe, on n'aurait pas su le niveau, la rapidité de propagation. Et donc, les ajustements se sont faits au fur et à mesure. Au moment où on parle de plus de 100 jours après la déclaration, nous avons déjà émis plus de 50 orientations techniques. Donc, il y a une évolution qui se fait et il y a aussi un ajustement que l'OMS fait rapidement en mobilisant des centaines de chercheurs dans le monde pour répondre efficacement. Donc, nous nous ajustons par rapport au virus qui est connu de mieux en mieux. Nous avons d'ailleurs organisé la visite en Chine de plusieurs experts du monde qui ont permis de mieux comprendre et d'ajuster. En ce qui concerne le pic, il est très difficile de prédire, mais de ce que nous voyons, nous nous attendons à ce que la situation se dégrade en Afrique. Nous parlions tout à l'heure de près de 14 pays qui ont déjà notifié de façon cumulée plus de 100 cas. Et cela augmente au fur et à mesure, même si pour près d'une trentaine de pays, la chance de contenir l'épidémie est encore là, mais à condition qu'il y ait une mobilisation de tous les acteurs du niveau politique jusqu'au niveau communautaire, et aussi une application dans l'approche. La démarche qu'on fait autour de chaque cas, en listant de façon complète les contacts, en les suivant de façon aussi minutieuse et en mettant en place des structures de tests et d'isolement. La directrice a parlé tout à l'heure de décentralisation. Toutes ces approches-là visent à donner encore une chance à la stratégie de contenir la maladie, même si pour certains endroits, on pense déjà à la phase de mitigation pour laquelle on devra aussi se préparer.
Okay. Merci beaucoup.
Thank you.
Dr Moeti, est-ce que je peux ajouter un mot concernant la première question sur
Bien
si
sûr.
l'OMS était surprise? Je crois que nous pouvons aussi demander est-ce que le monde était surpris ou pas. Donc, ce que je peux dire, c'est qu'après l'épidémie de l'Ebola en Afrique de l'Ouest, l'OMS a beaucoup travaillé avec des partenaires techniques pour appuyer, en ce qui concerne la région africaine, tous les pays, évaluer leur capacité pour faire face aux épidémies et travailler pour améliorer ces capacités. Nous avons appuyé les évaluations internationales indépendantes, donc plus que 40 pays, et nous avons appuyé 35 quelques pays pour préparer leur plan pour améliorer leurs capacités. Mais nous trouvons que le financement de ces plans, comme il n'y a pas une épidémie, n'a pas sorti au niveau international. Et nous devons dire aussi que nous avons fait le plaidoyer pour que le gouvernement africain investisse dans ce système-là. Donc, ce que je peux faire comme commentaire, c'est que nous espérons qu'après cette pandémie, il y aura établi des ressources internationales et nationales pour préparer le pays pour mieux faire face, pour avoir les capacités sur place, pour mieux faire place aux prochaines pandémies qui peuvent sortir. Merci beaucoup.
Merci beaucoup.
Merci. Just some questions here from, I'm just trying to put together a number of them just for our guests. From Tala Burki at the Lancet in London, how does the ability of countries to diagnose COVID-19 vary across Africa? From Neil Munshi at the Financial Times, is Africa following Europe's trajectory of cases? And if not, why not? And also from Pauline Bax at Bloomberg, how many countries have implemented or are implementing a screening program and how effective can they be? Perhaps I can turn back, Dr. Moeti, to you and your colleague, Dr. Yao, to address those questions.
Yes, so concerning the questions of what is the testing capacity in African countries, how does that vary? We now have 44 African countries that are able, or let me say countries in the WHO African region, which is sub-Saharan countries plus Algeria. And I think in North Africa, all those countries have the capacity to test for this virus. So this capacity is available in most of the countries. We have a couple of small countries like Lesotho, the Comoros, where we're working very hard with them on the last steps to establish their diagnostic capacity in countries. The challenge that we are needing to address now is the fact that in most of these countries, this capacity is available only in one site, sometimes in one laboratory in the capital city, and there is urgent need to expand this testing capacity to beyond capital cities as we see, and before we see the virus spread geographically within countries. So there is some testing capacity. There's a lot of work needed to expand it. And of course, we're facing very much the challenge of the procurement and supply of test kits and even some of the equipment needed. So perhaps I'll turn the other question over to Michel.
Oh, thank you very much. About the trajectory of cases, we can see that we analyze it based on a time that is required for the number of cases to double, for example. It's one of the indicators. And during the last 4 days, we can see that the numbers have already doubled. And if the trend continue and also learning from what happened in China and in Europe, some countries may face a huge peak very soon because they are having already local transmission and transmission within the community. So in the coming weeks, we may see few of the countries moving in that direction. About the country that are implementing the screening, it is actually linked to the lab capacity. It's only few of them. I can name mainly South Africa, where capacity is much more available. It's actually one of our main referral laboratory in our region. So South Africa is able to do so. I know that our Senegal are also decentralizing testing capacity, and a few other countries are also in the same process. The main challenge being availability of reagents on the market. WHO so far has been able to distribute a bit more than 1 million. Some are in the pipeline, but it's really the challenge is the availability on the market, despite support received from some of the country in terms of donation. The other challenge is also as it's a new disease, some of the testing that could have increased this capacity, like the rapid response, the rapid diagnostic tests are still in the process. Some may be available in the coming days, but the question will be how we can make it available for African countries.
Thank you both. We have a question on the line. I think Catherine Fiancan-Bakonga from France van Quatre here in Geneva. Catherine, we can turn to you for your question.
Yes, thank you for giving me the floor. This is a question particularly addressed to Marie-Pierre Poirier. I'd like her to elaborate a little bit more on children, particularly on the vaccination campaigns. You just mentioned a few minutes ago that it will be a little bit more difficult to deliver, but could you tell us precisely what are or which are the campaigns going on? We know that there are also outbreaks of different other outbreaks in Africa, like cholera. I would like also to know what you plan to do to keep children learning. We know that in most of the countries, there is a problem of electricity. So of course, e-learning is difficult. So what do you plan to do? And also what among the children, you spoke about the vulnerable group, particularly girls. And we know that there's also there are many children living in the streets in Africa. So do you have a particular plan to help them out? Thank
Thanks,
you.
Catherine.
Thank you.
And do you want that reply in French or in English?
I mean, English or French, whatever.
D'accord, merci.
Both of it.
Marie-Pierre.
Okay, so well, let's do it in both, starting maybe with English and then switching over. Well, thank you, first of all, for caring about how this is impacting children. Your first concern, immunization campaigns. The first thing I will say is that actually campaigns present particular modalities that do create certain risks. So what we are putting the emphasis on is strengthening routine immunization, which are administered, as you can imagine, without the massive groupings of people at health centers, and that can be carried out in ways that respect the necessary conditions to keep people safe. The basic problem, and it's a good opportunity to continue the valued work that we carry with WHO and other partners in terms of strengthening the capacity of these health centers, including at decentralized level, as Chidi Moeti was rightly saying, to do their job. Two problems, the availability of the supplies, I mentioned it, and so again, a huge plea from our side that humanitarian corridors are allowed to come to our countries, both for cargo and for people, human resources, and that we are able to carry out those important programs. Something that we are innovating with, you may be interested, is a lot of use of new technologies to connect to people and remind them of the schedule, of the immunization schedule. Huge emphasis on high tech, but also low tech and SMSs. For example, in Côte d'Ivoire, the 3 mobile service providers joined hands to send reminders on SMS, and they were able to reach 1.5 million people. So huge penetration, at least, of this kind of technology. You were asking, vous avez demandé également qu'est-ce qu'on fait dans le domaine de l'éducation et comment est-ce qu'on peut trouver des façons innovatrices de continuer à ce que les enfants apprennent. De nouveau, beaucoup de choses sont faites avec les technologies nouvelles, high-tech et low-tech, je pense qu'on dit ça en français aussi, avec la radio, les SMS, dans certains cas la télévision, pour essayer que les enfants, bon, quand il y a l'Internet, c'est aussi utilisé, mais tout le travail que nous faisions avant avec les pays pour essayer de développer ces contenus digitaux qui pourraient être mis à la disposition des enfants les plus vulnérables et qui ne vont pas à l'école, ont besoin d'être renforcés et d'être accélérés. Évidemment, il y a aussi les enfants qui n'ont pas du tout accès à quoi que ce soit. Nous essayons d'innover dans ces cas-là avec la mobilisation des énormes réseaux que nous avons avec des technologies nouvelles comme ça s'appelle les U-Reporters, des tas de groupes de jeunes et de volontaires qui sont en train de se mobiliser pour voir comment les contenus, les curriculums qui ont été développés pourraient être mis à la disposition des communautés. Les enfants de la rue, c'est intéressant que cette pandémie nous aide d'une certaine façon à mettre l'accent et la lumière sur ces groupes vulnérables dont on ne parlait pas trop avant. Énorme défi, surtout quand il y a des situations de couvre-feu la nuit avec des vérifications policières que personne ne traîne dans les rues, justement. Grande mobilisation dans beaucoup de pays de la région, y compris au Sénégal, pour essayer d'avoir des structures d'accueil qui se multiplient, de nouveau en respectant les règles de sécurité, mais aussi avec un très fort accent de passage de connaissances, d'informations, pour que ces enfants vulnérables sachent comment se protéger.
Merci beaucoup. We have on the line from Chinese Central Television in Brazzaville, Bai Jie. Can we just turn to you for your question?
Yes, I have a question for Dr. Moeti. I'm a journalist from China Central Television and based in Brazzaville. I know that a lot of African countries, they are facing short of COVID-19 testing kits. Is there a solution for this problem? For example, I know that in Congo, Republic of Congo, Just last week, we confirmed that they have just made only more than 200 tests. So I think it's not enough, far much not enough. If there are, maybe there are some potential patients, they are already contaminated one each other in this country. So how can we find a solution for this problem? And the second question is that, you know that Wuhan, in epicenter of this pandemic in China, has just finished its lockdown. But the lockdown in African countries, it's just the beginning. And we don't know whether its lockdown is strict enough or is effective enough. So when do you think the African cities like Brazzaville and some other cities in lockdown will achieve the object? Thank you.
Thank you. Dr. Moeti, Dr. Yao, can I perhaps turn to you for that?
Yes, thank you for those important questions. Indeed, we've emphasized repeatedly that, and my colleague Michel Yao already made allusion to it, that the shortage at the global level of diagnostic kits for this virus is a huge concern and a big challenge to countries. WHO is working with other partners to carry out pooled procurement and to position these test kits from whatever source we can find. We are also working with some of the countries through the companies that are producing these kits, make them available. As you know, some philanthropists are also procuring and transporting and providing some of these kits to African countries. It's one of the biggest challenges that we are facing. We are working also at the regional level with our UN colleagues to see how to put together our capacities with agencies like UNICEF, which have significant experience and capacity in procurement. I would say the principal challenge is the availability on the international market of these test kits. And then secondly, of course, is the transportation of what is available in the face of these prevention measures, the lockdowns and barriers and lack of flights that have been put in place by countries in their response to their pandemic. We are working on this every single day, trying to find ways in which whatever is available as test kits can be moved. Also working with our partners, the World Food Programme, which has got some transportation capacity in the UN, is one of the most acute issues on which we are working all the time. Certainly, we have through our country office contact with and are working with the local government here in the Congo. We are doing our best to provide those test kits. So that's my answer to that question. And then secondly, the lockdown measures are indeed being put in place by many governments and countries. Most of them have declared countrywide lockdowns. Others have more focused on some localities, which are, if you like, the hotspots of spread of the virus in some of the countries. We are very aware that the conditions of people's lives in some settings make remaining at home with the family, not moving anywhere, extremely difficult. Secondly, we're very concerned, and I think Marie-Pierre already alluded to it, that people who earn their living from day to day, and if they don't go out, if they're a market stall holder, for example, needing to sell some produce every day, then they will not be able to earn money to be able to feed their families. So we think that the lockdowns have to be implemented with very in-depth analysis of the feasibility, the appropriateness in whatever setting. So for example, if within a city, there are some contexts where people can feasibly stay at home and others where it is very difficult and almost impossible and might even constitute a risk of people spreading the virus among themselves, we need to think about additional measures that can be put in place. We are discussing with governments where the mitigation of some of the risks need to be put in place at the same time as the lockdown measures are being put in place. So for example, when people are not able to earn a living and vulnerable households are not able to have access to food, we are recommending strongly that the measures be put in place to provide basic food items for these families. This is being done in a number of countries like Senegal. So these are some of the recommendations that we're making. At the end of the day, we would like to emphasize that in addition to the lockdown measures, it's very important to implement sustainably, consistently, the public health measures of identifying cases, isolating them and their contacts, and making sure that people are carrying out the basic hygiene measures that are needed, whether they're outside or inside the houses. Thank you.
Thank you for that. We have Cara Anna from Associated Press on the line. We only have, we don't have video with you, Cara, but could you put your question? And then I've got a couple of questions off the back of that from colleagues at Thomson Reuters, and then we'll move to Agence France Presse. Cara.
Hi, yes, thank you again for the briefing. This is about procurement. Countries around the world are restricting exports of medical equipment. How will the WHO and other officials ensure that African countries get the supplies they need? What specific challenges do you face already? And since we do have someone from IOM, I would like to add, have there been any confirmed virus cases in refugee or IDP camps? Thanks.
Thanks for that, Cara. And also some questions from Thomson Reuters and from Reuters journalists in Nairobi and in Nigeria. From Nairobi, are you seeing a surge in demand in Africa for chloroquine? And is this a concern for patients who need it for ailments like lupus? Question from Reuters in Nigeria. The WHO sent a fact-finding mission to China in February of the lessons learned, which ones would not work for African countries. And just finally, what's the latest thinking on reasons for the relatively low number of cases and deaths in Africa so far? So if I could call on our doctors for those, and then afterwards we'll turn to Agence France Presse.
Okay, I think I'll give Michel a turn at responding to the first couple of questions.
Oh, thank you very much. About procurement is the same challenge, that availability of items in on the market, but also some of the border closing, as well as lack of capacity in cargos, because many airlines have stopped the flight in many African destinations. So this makes it quite difficult to have it. WHO is also trying to negotiate with some of the manufacturers, at least to secure stock for Africa. And for this, there is a need also for solidarity. Countries that have capacity to produce and also to procure more, there is a need to have this solidarity, to have a global approach in response to this outbreak, because we were mentioning at several occasions that the outbreak need to be addressed everywhere at the same time. If we still having many cases in Africa, it could also reinfect the other part of the world. In terms of about chloroquine, the chloroquine, the demand has increased. Is the side effect of this news going out, and our position as WHO is quite clear. It's a medicine that has some potential, but what we are saying is that there is a need to go through a clear protocol, and it's where the solidarity trials was launched, and this is to provide more evidence so that we can have a more clarity in terms of how effective is the medicines at which phase of the disease, as well as the effective posology and potential side effect at the dose that could be effective on the coronavirus. So without that, it's difficult to rush and make a formal recommendation on the use of chloroquine. And just to remind that 3 other protocols are also undergoing in many countries. The other question?
Oh, there was a question about the lessons learned from China, which might not be absolutely applicable in African settings. Well, I do think that the lockdowns which China was able to implement, as I've already alluded, can be a challenge in terms of the household structure and the reality of the sizes of families in some African settings. What I think is actually important is that we need to find ways to adapt these lessons. So it may be that something may not be replicated exactly as it was carried out in China, but we need to reflect on how it can be adapted for the local context, because the objective is the same. That is one. I think the other aspect is in the case management of the large number of people with COVID-19 in China. Clearly the level of, if you like, technical sophistication of their healthcare system was that they were able to monitor the patients in ways that are not feasible in many of our African settings. We know that, for example, the number of ICU beds and therefore adequately equipped systems, the laboratory systems in African countries are nowhere near the same as in China. What we have to learn from them, for example, is how to manage the illness early so as to minimize the number of people that advance to being severely ill and needing critical care. I took part, or I joined a session of exchange of experience between some Chinese experts and the South African minister and his team, and they were able to provide some very useful lessons, I think, that can be adapted to less resourced settings like ours in African countries.
And Cara just
last question is about
Cara just wanted to bring in, I think, Mohammed at the IOM.
Okay, good, go ahead.
Mohammed in Nairobi. Cara also wanted to bring you in on her question.
First, the question about that was initially asked by Dr. Moeti to Dr. Moeti. I just want to also stress the issue about how we're going to deal with mobility and how we're going to do the solutions without mobility, which is something we're grappling with. The whole issue about the porous nature of the borders in Africa, where right now governments are putting in lockdowns, but we see continuous flow of irregular migrants from one country to another country who are not going through the normal point of entry. An issue that we have to deal, obviously, with the states, but also with WHO and how we're going to deal with this. On the question about do we have cases of the virus in IDP camps or refugee camps, as far as to my knowledge to date in Africa, we don't yet, but the possibility is really high, noting that we also have our own staff members who are being infected by the virus, who are supporting and responding to the humanitarian needs in the IDP camps. In Africa, I don't see it right now. I have not to my knowledge yet. We've seen in Europe or in Greece, we've seen refugees who've been infected as well. Thank you.
Thank you very much. We have a couple of folks on the line. I wanted to try and squeeze in a question from Agence France Presse very briefly, but I know also we've got Ohiai and Elizabeth both on the line. So perhaps very quickly, we can turn to both of them and then get that question from AFP, Peter. Ohiai and then Elizabeth. I'm going to have to ask both of you to be quite quick.
Yeah, just a follow-up on the question of the lockdown in Africa. In Nigeria, for instance, 3 major cities, Ogun State, Abuja, the commercial capital here in Lagos, on lockdown. Is this really the right measure in containing the coronavirus? Yes, you talked about the fact
Great question. Great question. We're very short of time, so I'm going to have to turn quickly to Elizabeth, and then we'll hear from Agence France Presse.
Okay.
Elizabeth Merab.
I have 2 questions. The first one is...
One question would be great. Thanks, Elizabeth.
Okay.
We have 2 minutes.
Healthcare workers attending to the patients who've tested positive for COVID in many African countries are still going back to their families, and most of them are using public transportation. Aren't they inadvertently being a mode of virus carriage? And yeah?
Thank you.
What is the WHO doing to ensure that this does not happen?
Thanks for that question. And
merci. On aurait encore des questions à vous parvenir depuis l'Afrique francophone, et on vous demande juste de Philippe Alfroy de l'agence France Presse qui a posé ces questions en anglais. How do you explain that there was not a big surge of cases in Africa in the past few weeks? And does that have anything to do with the early enforcement of lockdowns? And do you still expect a tsunami of cases afterwards?
So really there, Doctors Moeti and Yao, questions on the lockdowns, questions on healthcare workers and public transport and how easy it is to control spread given the need to use public transport. And then finally, on that point from AFP.
Yes, I think to the first good question, what is important is to understand the purpose of the lockdowns and to find ways to achieve those physical distancing and minimization of transmission between people, and of course carrying the virus geographically or by people moving to the extent possible. So I think it's impossible to say absolutely no, but what is important is to adapt this to the context of the countries in the region. Certainly, I think that for people, what has happened in some settings, people hearing that the lockdown is coming and moving large scale to somewhere else, that is something that needed to be prepared for and prevented. At the same time, when we are going to confine people, we need to do so in conditions that will not make their lives difficult, that will make their lives impossible. It's difficult then, I have to say, for everyone, even in richer settings. So I think the importance is to adapt these and remember the basic purpose and to implement them to the extent possible, making sure that we then don't throw people into catastrophic situations in the context of doing that. And when we can't have people staying at home all the time, we need to take care that they do not constitute a place where the transmission is happening at home. Okay, Michel.
Yeah, about the health workers is actually the major concern because they work in a very difficult condition in many of the African settings. You recall that in the case of Ebola, infection prevention and control was lacking, and infection in hospital settings were quite a big number among the number of cases. Is why this component really need to be emphasized on, mainly infection and prevention measures that need to be taken. Among them is also items that is require protective equipment that are also lacking on the market. And we know that WHO is also recommending that health workers receive up to standard masks. They should be the top priority to protect them as well as protecting the family. Now, in a public setting for the population, I think a recommendation has been also shared because some of the local solutions, we should also be aware about the limitation. At the same time, in very crowded environment, there are precautions that need to be taken. So some countries have moved ahead with our clear recommendation on this topic.
Doctors, thank you very much. Sorry.
Just a word on the final question. Is it the lockdowns that are moderating the spread of the virus in African countries? I think it's too soon for us to be able to make that assessment, but we are monitoring very closely to see if that is the case. I have to emphasize that if we take the whole region as a whole, yes, it does seem to be moving slowly, but there are several countries, as I said, where there is community spread and the numbers are changing very quickly in these countries. It is growing very fast. This virus came later to African countries than it started in Asia and in Europe. And we are concerned that it might spread in the same way in African countries. But hopefully by then, the strict measures that I talked about before for public health containment and the lockdown measures will start to have an impact. The lockdowns are having a big cost that we really need to work together to make sure that we benefit from them in terms of the impact. That's what I'd like to say. Thank you.
Thank you so much. We've just run a little bit over our time slot, but thanks to all our participants who joined us. Thanks to Doctors Moeti and Yao in Brazzaville, Congo. Thanks to Marie-Pierre Poirier in Senegal, to Mohammed Abdiker in Nairobi, and to Elsie Kanza, the Forum's head of Africa here in Geneva. Thanks to everyone who put a question. We hope we'll be able to get round to more of your questions in due course next week. And apologies for those we didn't manage to get to in this session. From us here in Geneva, from Peter Vanham and myself, Adrian Monk, thanks to all of you and safe Easter.
Au revoir.